Hello everyone, today we're going to learn how to prevent pain in the neck through cervical retraction. That's the medical term for it. It's basically moving your neck straight towards the back in order so that you can reposition it back to neutral, or if sometimes when you have pain you have to reverse the curvature from the back and straighten it back to neutral. Why is this important? This movement is the precursor, meaning before you can turn your head side to side or tilt your head up and down, you have to have your neck in a correct alignment. Correct alignment is when your ear is aligned with your shoulders. If your head is forward, then you need to do a retraction, bringing the back of your neck towards the back in order so that you can turn your head fully in full range on either side, or tilt your head all the way up without any obstruction. So that's what we call precursor movement. So cervical retraction is a very basic movement in the neck that we need to reestablish in order so to prevent pain in the neck, or if you do have pain, to get rid of the pain. So how do you get this? If, say for example, you have pain in the neck, patients that I encounter are sometimes work in the front desk for 8 straight hours and are in their computer for the most part of their shift, bending and in a slouch position. So if you're a habitual sloucher, you'll get neck pain and your head gets into this forward head position. If you sleep with several pillows, especially if you put the pillows right under your head, and instead of providing support as well in the shoulder blade area. So when you position your pillow, you should position it so that it's supporting your shoulder blade and your head at the same time. I sometimes recommend, if you can tolerate sleeping without pillows, that would be even better. How do you also get this position is sometimes if your thoracic spine is very tight, then your head goes forward. The other thing that it could happen when you have an accident and you get rear-ended, your head goes into forward and back position. That can create pain in the neck, depending on the presentation of the pain. Sometimes if you have pain on the neck and it goes as well as the headache, especially if it's headache just as one side, there might be nerve upper cervical compression of those nerves. If you have pain in the neck that goes down to your arms, maybe the lower cervical nerves are affected. So you do these retraction movements in order so that we can decrease the compression of those nerves. And depending on the, again, presentation of the pain, there are some subsequent movements that are being progressed to after doing the cervical retraction. So let's try these cervical retraction movements, and I hope that this will help you. If you do have pain, I would recommend that you do it every hour. I usually tell my patients, just give yourself an alarm. So you set your phones in that it will alarm you every hour, every 2 hours, so you could do these exercises. This exercise is very simple, doesn't take a lot of your time, but it will help you to reposition your neck so that eventually you could get rid of the pain. But if you don't have pain and you just want to make sure that you're in alignment, you don't have to do it every hour. You could do it first thing in the morning and then before going to bed, especially if your job is, it requires you to sit for too long and you're in front of the computer for long periods of time, or say, you know, you're using your phones a lot I would recommend that you use your device close to your hand, bring it towards you instead of your head going towards the phone. So those are my tips for today. Let's get on with cervical retraction movements.
Begin with sitting upright, with your buttocks seated all the way back, and use a rolled towel in the small of your back. Make sure your back is resting against the back support of the chair, and you are looking restrained ahead. Move the back of your neck straight to the back without tilting your head. Do it 10 times. Take 3 deep breaths in between. Then do it again.